So I'll be talking about our model of breakthrough change or large improvement in workplace health and safety. It's essentially a multiple case study, and it's the first of 3 studies that we have underway. And it's really the launch of the major findings from the first study. But I would first like to acknowledge the members of the research team, and in particular Ben Amick, who is the co-principal investigator, and Cindy Moser, who was the project coordinator at the time. We had multi-stakeholder support for this project, and I'd particularly like to note the 3 health and safety associations who were partners. They provided a letter of support, and they also helped us reach out to the workplaces and recruit them for the study. I have 4 messages that I hope you will take away, and I've structured the talk accordingly. The first, I hope you'll appreciate that we took an innovative approach in this study. Secondly, I'm going to introduce you to a model of breakthrough change. It consists of 12 elements and focuses on the process of change, and we think that's what's different. And we're going to take a bit of time, partway through, not just at the end, to think about what this might mean for your occupational health and safety professional practice. And I'm speaking particularly to the practitioners in the room. And we do this for 2 reasons. One is so it'll help you, apply the model and be able to walk away with it in your minds. And for us, it helps us understand your interpretation, your perspective. It gives little clues to where we should be thinking going forward. And then after, I hope, convincing you of this compelling model through our stories from workplaces, we'll then take a more sober reflection and remind you it is based on exploratory results and needs to be treated accordingly. So our main research question, paraphrased, is what critical success factors are common among firms making large improvement in health and safety performance? And the inspiration for this, well, you've heard, I've been here for 17 years, participated on systematic reviews, and I've been witness to too many carefully crafted workplace interventions, carefully implemented, that end up having small, hard-to-detect effects. And yet, I and we all want to see large change. So this took a different approach, and it said, well, where are those firms that have made large improvement? And what lies behind that improvement? And we know from the trade literature there are instances of large improvement. So we wanted to collect some of those stories, but do it in a researcher way. We wanted to systematically identify those firms and systematically collect detailed information about those stories. And in doing this, we're addressing a research gap. There is a fair amount known from research and practice about what distinguishes a high-performing firm in occupational health and safety from a low-performing firm. So the higher-performing firms have more effective risk controls. They'll have a management system that's developed enough appropriate to the risks. They'll have a culture and climate that's favorable to occupational health and safety, and overall take a proactive approach rather than a reactive approach. But the research doesn't really address the process of change. So assume a workplace wants to improve. What should it do first? What should it do next? Who should it involve? And I'm not sure, at least at the time we put this grant in, I don't think the practitioners had the answers to these questions either. And I see Monica shaking her head, and it's some validation that the situation remains the same. So we hope to offer something to this. Our research took a 2-stage approach. In the first, we needed to find the firms that made the largest improvement in health and safety. And then the second stage was to study those firms and find out what was important in terms of their improvement. And so to do this, in the first stage, we first of all screened the WSIB statistics, and Michael Swift and his programming was key to this, and Peter Sabrata extracted the data in the first place. And we screened the statistics, and then, as you know, there's lots of issues with the claim statistics. We needed to, so we observed a large decline, but we needed to talk to the people there to differentiate artifact from true change in performance. We wanted to make sure that the firms we were studying hadn't changed their claims profile through dodgy claims practices or something as simple as maybe a merger or outsourcing their risk. So that's what the short interviews did. And then once we had selected our cases for in-depth study, we spent 2 days on site interviewing people at all levels of the organization, some involved in health and safety, some not. We reviewed documentation, things like committee minutes, manuals, and also observed the work site, asked them to show us what changes had taken place in the previous 10 to 15 years. And we also obtained records of enforcement activity for all those workplaces. Those are the 2 stages, and we hope to add a 3rd stage eventually, and that would be to develop interventions based on the findings. And if and when we do that, we would have taken what's known as a positive deviant strategy to developing interventions. And that's because we've been focusing on the positive deviants. So the firms that made the largest improvement. So they're deviants, they're different than the norm, but they're deviant in a positive way. And this approach is found to be an efficient way to develop effective interventions when faced with a complex environment, and it's hard to know where to start. Let me take you back to where we're searching for our positive deviants in the WSIB claim statistics. This illustrates the approach we took. We set up some criteria with the algorithm, with the programming that Michael did. We first of all, so we were looking at all Schedule I firms and converted their claim rates and expressed them as a percentile ranking relative to others in their rate group. So essentially their industrial subsector. And then we looked for firms that had gone from being among the 50% in their rate group with the highest claim rate to being among the 20% with the lowest claim rate over a period of a decade. And to do this computation, we had at least 3 years of data on either end. We were flexible. We said, okay, this could be 3 to 7 years. This could be 3 to 7 years. This could be a quick change or a sudden change. And this period in here could not go outside these bounds. And when we applied those criteria, oh, and I should say, we wanted to capture all types of trajectories, quick, slow, so that because we were open to all types of interventions. It could be culture, it could just be, improving the line, putting in new equipment. Either we would be interested in, even if it weren't for the purpose of health and safety. But we didn't find many of those types of firms. In any case, this is how the flow of firms worked. We started with firms with 75 full-time equivalents or more over that entire period. There's 2,600 of them if we limit it to those firms that had at least 20 in their rate group, right? Because we were doing the percentile ranking, so we wanted to have at least 20 to make that percentile ranking meaningful. We applied those criteria I just showed you, and we ended up with 67 firms that made that size of change. And we looked a bit closer at the claims trajectory, found some noise in some of them, if you will, variability, and through a Delphi process, focused on half of them that had the strongest signal-to-noise ratio. And then with the help of the health and safety associations who made the first contact, we tried to recruit these organizations to our study, just to the brief interview. And after multiple tries, only half agreed to a brief interview. Typical for workplace studies. Not bad, 50%. And then when Cindy applied her journalistic skills and learned about how and why did those claim rates come down, we found that for 12 of them, they had a story to tell us. There had been intentionality. So for us, they're what we call breakthrough change cases. They're organizations that made large intentional improvement in occupational health and safety. And one thing we learned at this stage was that there were no magic bullets. Maybe there's some magic bullets there, and the folks that chose not to speak with us, they just changed the line for some other reason, had nothing to do with health and safety, maybe. But of those that spoke with us, 12 of 15, had this story of change, and they had done multiple things. And so we end up with, when we compare it to the number we started with, we have 1 out of 200 making that sort of change. And those cases also provided a pool for selecting firms for our in-depth study. We selected 4. That's all we had funds for in our, first project. And so we purposely went across industrial sectors, and we just happened to end up with firms that were about medium-sized and a mix of non-unionized and unionized. These are their claims rate profiles, just normalized to a maximum of their own in that period. You'll see that one workplace changed rather rapidly, and the other 3 more gradually. So I mentioned how we spent time on site. So we had those data, we had the MOL data, we coded our interview data, we really deconstructed that information and then re-synthesized it into that story, a story for each workplace. And we tried to identify what seemed to be important for that change process. Thinking about the process, what they changed in the workplace, as well as the context. And then we looked across all 4 cases to find out what was in common. And for what I'm going to show you now, we had the criterion of it needed to be in common to at least 3 cases. And so there's 11 elements in the model from that analysis, and the 12th is the outcome of changed injuries and illness. So I'm going to show you the model in just a moment. There's 2 slides I have to show you. And this is just so you'll know the lenses that we were using when we analyzed the data. So first, of course, we did keep in mind the prior research that tells us about correlates of health and safety performance, the difference between high and low performers. We also kept in mind the OHS management standards. And we had reviewed the literature on organizational change. Now, as we continued our analysis and we continued reading in this large body of literature, we found there were 2 other bodies of literature that were relevant. One was organizational learning, and the other positive organizational scholarship. So turning to the model, I'm going to start at what's at the core of the model. And that's a transformation of knowledge that was previously external to the organization. And that knowledge entered the organization via either hiring new people or by establishing a relationship with OHS management consultants, an ongoing relationship. And these were consultants either from, in two cases, health and safety associations, and in another case, private consultants. So at the core of the model is this transformation of knowledge that was previously external to knowledge that became internal and integrated. And this little box of integrated OHS knowledge really represents a lot of what we already know about high performance. And in their stories of change, we heard about changed policies, procedures, practices, communication, reward structures, responsibilities. And we also heard about how risk controls had been improved. And that ranged from the lowest level on the hierarchy, so improved use of personal protective equipment, but it ranged through all the way to elimination of hazard. And included training, administrative controls, substitution. And plausibly, these changes led to the changes that we observed in the claim statistics. So returning to the other end of initiation. So not only was this new knowledge important, there needed to be a key individual. These are special individuals we found who orchestrated that transformation. So they were someone who either brought in new knowledge as the new hire or were the recipient that worked with the management consultant. They mobilized the organizational skills that were necessary for the transformation. And they had power. It was partly some, formal power. They might have a title of health and safety coordinator or have one added to their existing title. But we found they also had a lot of informal power. And that was based on their people skills. They had great relationships with both senior management and workers. So relationships of trust, respect. And there was a third element that needed to be present too, and that's organizational motivation. So we found they appeared in different orders, but all three needed to be present. And what really brought them into play, finally, was some sort of external pressure. So I'm going to show you how this played out in two cases now. Turning to one of the manufacturing examples, they had actually undergone a work-well intervention and in a sense had an exposure to health and safety knowledge, but it never became integrated. They wrote procedures, they passed the audit, but it never became integrated and well implemented. And a few years later, there were also signs of the management developing more motivation about occupational health and safety. It became part of their picture of performance, became part of what they talked about. But it was only with the intervention of the Ministry of Labor in the high-risk firm initiative that there was a phone call to corporate headquarters in the United States, which then leaned on the plant manager, who then hired, for the first time ever, a health and safety coordinator. So this was more than 200 employees, heavy metal manufacturing, and Tess, not her real name, was hired. She brought with her her college credentials and also a good deal of knowledge that she had developed by being a worker on the floor once upon a time in other workplaces. And she knew where to continue to gather knowledge that she needed. So that's when initiation took place, and that's when we hear about events that led to the claims decline. The second case, quite a different workplace, group homes. And in this case, there was a person already present who became the knowledge transformation leader. But he really didn't play that role initially. He was focused on HR in general, other dimensions of health and safety. It was only after his interaction with an HSA consultant that he developed the realization that their performance in health and safety was really lagging. It was subpar, and it really lagged, given that the organization as a whole was seeking excellence. So we developed the motivation, and the consultant was also the source of new knowledge. And that's when the initiation took place in this story, this case. 4 cases. The details differ in these boxes, but it's the same general pattern that I've described. And now I'm turning to the external pressure, just to make the point that they were varied. I've already described for the 2 cases how it was the Ministry of Labor in one case, how it was an HSA consultant in another case, stick and sermon, 2 different approaches. And then for the 2 remaining cases, there's even more variety. For the plastic company, it was in the form of a market incentive. The people they wanted to deal with and have as customers put a priority on health and safety, and they needed to be able to show they performed well. And so that's considered a carrot, right? So what I'm referring to is a typology that's been put out. We have sticks, carrots, and sermons. And if we look even just in those 4 cases, we see the full typology being used. It's only 4 cases, we can't generalize, but it seems like all those different types of interventions out there that the prevention system uses, it seems like all those tools are important. Different organizations respond to different things. Okay, so that's, again, the initiation end. I'm just going to turn to the middle up here, the transformation domain, and tell you about 3 elements to do with process and 2 to do with context. So the first was organizational responsiveness. And what we heard was that when the organization would respond to an individual's health and safety concern, that behaved almost as a catalyst. That for that individual, if the organization responded in good faith and responded promptly, it encouraged them to put forward a concern yet again and be involved in health and safety. And for the people around them that witnessed that incident, it encouraged them to repeat that behavior. So, like a catalyst. The second is really a broad bucket called positive social and psychological dynamics. So we were struck by, we weren't looking for when we went in, it wasn't in our coding framework and really emerged from the data, but really these repeated instances of positive phenomena, if you will. So energizing interactions on the Joint Health and Safety Committee, committees that became vibrant, that developed the right energy, collaborative relationships between the committee co-chairs, empowerment of workers, workers with voice, workers that were passionate about health and safety and had an opportunity to put it into concrete practice. And one example of transformational leadership in a production manager. Okay, third, overall, we would say there was a pattern of continuous improvement in that these workplaces didn't just undertake a flurry of activity and then rest on their laurels. They really just looked around and said, oh, well, what's next? What can we do next? As far as context, there was a theme in here of simultaneous operational improvement that could have had some effect on the outcome on its own, but also seemed to facilitate health and safety. For example, in one of the manufacturing organizations, they developed better control over their processes, so there was less chaos, and individuals were freed up to think about safety. In group homes, as you heard, one of them was, I said, had a model of excellence in mind. In fact, it was seeking accreditation. And so they adopted some practices like developing performance indicators, not only for safety, but for all aspects of the organization. But in a way, I see health and safety kind of piggybacking on that drive for improvement. And then we would say, based on past research and what we heard from people, that the organization was supportive of this improvement in health and safety. There was only one case where the senior manager, that was the owner of the grocery, was the driver of change. But in all workplaces, senior management was supportive. And there were good employee relations between management and employees. There was low turnover, even in the grocery. There was certainly turnover in the part-time staff, but the permanent staff had low turnover. And finally, the maintenance department was responsive to health and safety concerns. So that summarizes our model. Our model, really a way of synthesizing all that detailed information and trying to, that we found in the cases, and trying to find a common pattern, common themes, common elements. It's packaged this way really to help us conceive of it. And so now I would like to turn things over to you for a little while. I would like you to reflect on the model and consider, especially for those of you in the, those of you here who have struggled with improving workplaces, does this model ring true? And secondly, what implications, if any, does the model have for your professional practice? So now we come to the sobering part. I find it exciting to talk about the model, and then I have to remind myself, well, this is only a small sample. It's based on 4 cases, 4 important cases, 4 important deviants. And, a limitation in going into these workplaces, and then we talked to 10 individuals, and then tried to cross-validate and find where there was consistency and try and, find something in a document that dated what they were telling us in an interview. We did all that, but, inevitably there's some error, missing data, bias in looking backwards, uncertainty in dates. And, a major limitation is that we don't have the contrasting cases. That, of course, was in our first grant proposal that didn't get funded. Anyway, we've now been able to look for those cases in 2 subsequent studies. And I'm going to tell you about them. The idea is here, okay, we found these, breakthrough change elements. Well, could we see those same things in place in the so-called stay the same firms? And if they are there too, well, why did it seem to be important in change here but not there? There's probably something interacting with it. So that type of teasing out testing can be done with the contrasting cases. So 2 slides. This is our Breakthrough Change 2 study. Picking up what I flagged earlier, we have the Ontario plant. So this was in our first study. This is picking up on the productivity question. We have the Ontario plant. They made large change. We learned in the course of them sharing some data with us that they had sister plants, one in the US, one in another province. And their claims profile looked different, even though they had similar processes and the same corporate oversight. So it was a natural contrast that we received grant funding to explore further. And we have collected the qualitative data. Siobhan is the project coordinator of this study. And we conducted a survey to compare the 3 sites. So that was a point in time. We can compare them with survey data. And the third piece, which we're still twisting arms about, but we do have a meeting this week, and that is to obtain further of the administrative data. We would like to see the HR data on turnover, and we'd like to see their measures of production and quality, and see how it corresponds with the claims outcomes. So we think with the size of the plant that we can only really do a qualitative sort of correlation. Bit of an oxymoron there. So switching to the third study, Breakthrough Change 3, and Diana Pashik worked on this one. This is going back really to that first study. We have these cases here, just reminding you of that. And what we did in this third study was seek the matched stay the same firms. So we went back to that original data segment of time, so 98 to 2008, and looked for firms that were of similar size, same sector, but hadn't changed to the same degree. And we were able to identify, and we approached them with the health and safety associations, but unfortunately, only group homes agreed to participate. We struck out in the for-profit sector. Maybe they were more willing to talk about their successes, right? And we think that if we were to go after these again, we would need to compensate them for their time. But in any case, we do get to look at the contrast in this in the group home sector, and those analyses are underway. From anything that we've seen so far, there isn't anything that makes us look at that model I presented and say, no, it's wrong. But there will be, for sure, refining. So that's what we have in mind for the future. We'd like to look at more cases. We'd like to move to quantitative measures. This is in the medium term. The ideal, we think, would be to follow a group of firms over time and then following them from the outset, right? Conducting interviews, conducting surveys, so qualitative, quantitative measures, and follow them over time. So we're not asking people to remember backwards. We're collecting that data prospectively. And I'm thinking of a group of firms that are poised for broad change in occupational health and safety, like safety groups, or if there's a group seeking accreditation. And so if you have access to a cohort like that, we'd certainly like to talk about that in terms of a future research proposal. And then in the long term, we would like to develop interventions, implement them, and evaluate them, and in doing so, really carry out that last step of a positive deviant strategy approach to intervention development. Well, great. Thank you so much for your attention and your engagement with the topic.
Thank you, Lynda.